name's Daniel.
And I'm Erin, and our role today is to find out what CSOG is and how it affects us in our community.
Today we're going to be interviewing the key members of CSOG.
CSOG is the Critical Services Oversight Group, and what it does is it ensures that the work we're doing in some critical service areas like child protection and adult protection, violence against women and girls and offender management, it ensures that we're overseeing that as a group of chief officers from Midlothian Council, East Lothian Council, the NHS and the police.
What it does is it oversees the work that lots of different teams do within our communities and with families to make sure that we have services in place that protect them as ably as we can and stop them being fallen into even more crisis situations, fallen into even more poverty, for example, or if it's children suffering from even more neglect than they may have started out with.
When was CSOG established and why was it formed?
The Joint Critical Services Oversight Group, that's covering East and Midlothian, was formed in August 2008. And the reason it was set up was to provide leadership across a series of critical services. These critical services are about child protection, adult protection, violence against women and girls, and offender management. And it was just to absolutely ensure that all the relevant services and all the relevant people were working together to protect the most vulnerable people in our society. That was the reason behind it.
So what age range and groups of people does CSOG support?
Well, CSOG is there to, on an interagency basis, to provide support for support and commission services for all age groups, so across the whole lifespan. So that could actually be from birth right up to the end of somebody's life, and sometimes pre-birth if there's concerns about a pregnant woman. So actually everyone really.
Well, for me, CSOG has both a proactive and a reactive role. So it's partly about that strategic leadership and direction, overseeing the work of the Public Protection Committee, the people that work on our behalf to ensure that vulnerable people in our communities are safe. And that's about ensuring the right strategies are in place, that the performance is good, that quality assurance is taking place, and that we're monitoring trends. So that's one aspect of it, ensuring that all the people in the various agencies are working together and playing their part. And the other aspect is sometimes we look at very specific cases or particular incidents, maybe where things haven't gone right or not as well as we would have liked, and we see what learning we can take from that to ensure that next time things go better.
No one agency can protect children on their own, so it is a collective responsibility. So my role is to work with other CSOG members to ensure that collectively we've got services available, and there's a number of things I think that we need to put in place for that, and that is about policies, it's about procedures, systems and processes, and that staff have the resources to do their job. So I think that's my job.
In terms of any advice that I would give someone who needs support, I think the most simple thing I would say is don't be frightened to ask for help from any adult who's in a position of trust. So from my point of view, obviously as a police officer, it's very visible that I would like to think that children or adults or grown-ups who need help could just ask for that help in any shape or form, and my officers would be keen to help. And it's not just police officers who can give support, it can be any other health professionals, so nurses and doctors, or people in positions of like school teachers or the janitors. Anyone like that will be available and happy to help. I think one of the things I would like to say is that for any children who are thinking about being concerned about feeling at harm or at risk, that it's okay to tell someone.
Well, there's lots that people can do, because it's really everybody's responsibility to make sure that we look out for people that need a bit more help than we probably do. So what we would ask in CSOG is that anybody who sees somebody who might need a wee bit of help, or whom you think is maybe struggling a bit, or doesn't want to ask for help, or maybe not being looked after the way that they should be looked after. So we in the community need to be the eyes and ears of these people, and if we see things that are not being done properly, then we need to make sure that we report it to somebody. So you can report it to lots of different people. Teachers are always a really good starting point. If you think that there's something not quite right, then you could do that. Your own parents or your own carers would be another useful starting point. Or if you do have a social worker, then you would speak to your social worker, or you could actually speak to a police officer if that was the case.
So what can other people do to support the work of CSOG?
I think I probably see it in other ways, that the Critical Services Oversight Group is a group that exists of important people, I suppose, but our job is to make sure that all the services that are provided to help children and vulnerable people are the best that they possibly can be. So it's really nice that people are interested in the work. It's good that everyone knows that we are there and we're working very hard. I think the important thing is that group works at its absolute best to make sure that all the school teachers, nurses, doctors, police officers are there to provide the best help that they can to people who need it when they need it most. So it's really nice to know that people want to help us, but I suppose from my point of view, I'm really keen that we are there, you know about us, and that we're there to help you. So that's part of what we're doing here today. We're talking about it, and that's good. We can raise awareness. And if anyone does need help, that's what we're there to do. So thank you for your support. Thank you for asking. And it's really just about what we can do to help people when they need us most. So that would be my message, I suppose, going out from here, is we're here, we're working very hard, and doing our best, and thank you for your support, thank you for your interest, and we will do our best to make sure we keep you safe.
Thank you so much for answering my questions today.
You're welcome. Thank you.